Well, the Omicron variant of COVID is still sweeping our state. We are noticing more children getting sick.
Dr. Jody Terranova, a pediatrician at UConn Health, is joining us now with some answers to many parents' questions. Thank you for joining us, Doctor.
Thank you for having me.
Doctor, I know, as a parent, I thought the one thing that was maybe a silver lining about this pandemic is we were so much more concerned about adults and older people and feeling like our kids were sort of safe.
Right.
Is that changing with the Omicron variant? I noted that some of the numbers at children's hospitals seem to be going up.
We have seen a lot more children impacted over the last couple of weeks with this new variant. Thankfully, still, the majority of cases in children are on the mild side. Certainly not all of them are, and we are seeing more children with very high fevers, children in the hospital, just related to a higher number overall being infected. So these last couple of weeks have really been crushing for families and for pediatric practices.
Why do you think this variant is affecting children more and more, these days?
Well, part of it is that children are still the largest group that are unvaccinated.
Okay.
And so this virus looks for a host anywhere it can find it. And certainly the easiest hosts are those that are not vaccinated. So children under 5 can't yet be vaccinated. And the 5 to 11-year-old group recently has been able to get vaccines, but we haven't seen as large a number of patients in that age group getting vaccinated as we have seen with older kids and adults.
Yeah, I think because, a lot of parents, and I get this question all the time, are concerned about the vaccines. How do we know they're safe? What's your answer to that?
Yeah, so we know they're safe. They have been studied. They have been given to millions and millions of people around the world. And with vaccines, we really look for any short-term side effects because they are introduced into the body. Your body mounts its immune response. And then the vaccine is really no longer there. It's your immune system that's going to respond. So we're not concerned about any long-term effects from this vaccine or really any others that we have given over the decades. So we know it's safe. We know the side effects are very predictable. So we know we can expect a fever or some tiredness or some achiness in our body. So we can manage those. What we don't know is how the virus will impact us. Some people, it's mild, and some people are very sick. And that is very unpredictable and more difficult to manage.
Is the vaccine for the adults the same exact vaccine as the children are getting, or is there a little less in the children's vaccine? Or
yeah, so they're made the same, but you're correct. The amount of the vaccine that is given is smaller in children.
Okay.
They get a smaller dose compared to the adults. The 12 and up are all the same. 12 up through 100 years old. But the 5 to 11 is a smaller dose. It's a third of the dose for Pfizer. And then for the kids that they're testing, the 2 to 5-year-olds, it's an even smaller dose. And so we'll see what that will be hopefully in the coming months.
Okay.
So if you're looking, what are the symptoms that you should be concerned about with your kids? And is it safe to send to school? I know sometimes they're like, hey, if your kid even has a sore throat or a stuffy nose, we need to think that it could be COVID.
Absolutely. And so for children, they are getting some of the respiratory symptoms that adults get: sore throat, cough, congestion, headache, kind of the head cold symptoms. But we also see in children a lot more of the stomach virus type of symptoms: diarrhea, vomiting, stomach aches. That has probably been the most common symptom that we're seeing in children.
Okay.
The COVID-19 rules seem to keep changing. What do we need to know right now, Doc?
They do change. We can hardly keep up, right? So a lot of it is common sense and doing the best we can to use variety of ways to stay safe. And so wearing masks in public so that we don't spread the virus and try and keep us from catching the virus, keeping a little bit of distance, getting vaccinated, washing our hands, staying away from people when we don't feel well so that we don't get anyone else sick. And really just kind of those common things that, our mothers taught us as we were growing up. That's the best that we could do. The quarantine numbers keep changing. How many days do you need to stay home and all those things? But really it's stay home until you're feeling better so that you don't get anyone else sick.
Okay.
And masks, is there one, just can you settle that as our final question? Is there a better one to be wearing right now?
So masks are tricky. So the best mask to protect you from catching the virus is that N95. For children, there's really not an N95 that's made specifically for children. They're really made more for the medical professional setting. So for children, we want a well-fitting mask, something that fits as tight to their face as possible, that's comfortable, that they'll keep on, one that is multi-layered, and more of a surgical type of mask compared to a cloth mask is better, but really any mask is better than no mask. So the best that you can get is what you should go with.
Thank you, doctor. We appreciate your time. Have a great day and a great weekend.
You too. Thank you very much.
All right.